What can I do? I mean, what can I do to lower my cholesterol? What can I do on my own? What can I do that will help my numbers? This is usually the first thing my patients will say, or rather ask me, after I've told them they have high cholesterol. And guys, this happens all the time, meaning that's what patients are always asking. And it makes a lot of sense. You've just been told you have high cholesterol, so you want to know what you can do. Well, I'm going to give you lots of tips and tricks today. You want to have some a notepad handy, or at least take some mental notes. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. First thing is diet. The diet is so important, guys. I cannot tell you how important diet is when it comes to lowering cholesterol. And this is something that you by and large have control over. So let's go through some specifics on things you need to do and not do. First of all, limit your sweets, limit sweet beverages, sweet drinks, and also cut back on red meats. In addition, you want to make sure that you're eating veggies, fruits, whole grains, low-fat dairy. That's a super important one. Poultry, fish, legumes, nuts are totally fine, but when it comes to oils, you want to stick to non-tropical vegetable oils. That's super important. This is according to the American College of Cardiology and the American Heart Association. In addition, there are a couple of diets that are awesome that sort of incorporate these things I've been talking about. One is called the DASH diet. That's DASH. Guys, I've done a video on that. You might have seen that. That's a diet that also is helpful for high blood pressure as well. Awesome for cholesterol. Check out that DASH diet. There are a few others as well, but I think that's a really great one. The other big part of this is lowering your saturated fats and your trans fats. That's right. You can look at labels and see what's in the food that you are eating, but lowering saturated and trans fats is huge. So diet, number one, you've got to pay attention to your diet. You've got to cut back on some of these things that we know are not the most healthy. Number two is exercise, but I'm not just going to tell you, just go exercise. I'm going to give you specifics, okay? This is according to the American College of Cardiology and the American Heart Association as well. They say to exercise 3 to 4 times a week, around 40 minutes per session. And you want to make sure that your activity or exercise is moderate to vigorous. That means we want you sort of breaking a sweat, getting your heart rate up. I don't want you just sort of lollygagging around. Now, of course, you got to exercise according to your personal limits, to your personal exercise tolerance, and according to your underlying medical conditions. So you got to take that into account. Have your doctor help you figure out what you can do. But you've got to exercise. This is so important. And by the way, both of the things I already mentioned and most everything I'm going to say during this video will help you not only with your cholesterol, but with blood pressure, your waistline, and so many other things. And speaking of waistline, yes, losing weight actually matters when it comes to lowering your cholesterol. You want to lower your cholesterol? Well, work on losing weight. Did you know that decreasing your body weight by just 5 to 10% can make a positive impact on your cholesterol? That's right. This is big, guys, because these are things you can do on your own. You can do at home. So making sure that you're keeping a healthy weight or losing weight if you need to. Number 4 is to quit smoking. Yeah, smoking is not really good for much of anything, to be honest with you, okay? Want you to quit smoking, not only for your cholesterol, but for your risk for lung cancer and for so many other things. Quitting smoking can decrease your bad cholesterol or your LDL, which is good, and increase your good cholesterol, which is your HDL, also good. Win-win, win-win-win, right? Those four things that I've mentioned are things you can do on your own, super important. The 5th thing is take medications as prescribed by your doctor. Now, I know you might be saying, but Dr. Jen, I want to know what I can do so I don't have to take medications. And you know what? It's all good. I get you. And you know what? If your doctor says you don't have to take medications, well, that's fantastic. But in some situations, your doctor may recommend and suggest that you take medications for a number of really important reasons. That is a viable and a valuable way to lower your cholesterol. Let me say something about that. A lot of my patients feel shamed when I tell them that I recommend they take a cholesterol medication in addition to doing these other things I mentioned. They say, well, I feel like, I don't know, I feel like I've failed. I feel that like I'm less than. I feel like I'm somehow inferior. Something's wrong with me that I need to be on medications for this or that or what have you. And let me tell you, I always say this to my patients. You know what? If this medication is going to potentially increase the quality of your life, increase the length of your life, reduce the risks and the problems that you may have in your life, such as cardiovascular things, etc., it is worth it. Now, of course, that requires a more extensive discussion. It's not always that simple. But the truth be told is that there are some people that do need to be on cholesterol medications. And you know what? If that's you, I say embrace it. Why? Because the truth of the matter is that medication may very well help you live a longer, healthier, safer life. In addition, we want you to make sure that you are doing these lifestyle changes, because these lifestyle changes are always important, whether you're on medications or not. If you have questions about medications and if you should be on them, if you can get off of them, all that kind of stuff, don't do anything without talking to your doctor first, because of course we want you to do that. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. If you've not subscribed to my channel and click the little bell for updates, please do. I do daily videos. Guys, I'll see you soon.